Hi, and welcome to DIY Breastfeeding. I'm Ashley Treadwell, an international board-certified lactation consultant with the San Diego Breastfeeding Center, as well as a featured expert on the Boob Group podcast. Today we're going to be talking about the aftercare that's involved after a baby's had a frenotomy. A baby needs a frenotomy when they have been identified as having either a tongue tie or a lip tie. If you think your baby is suffering from a tongue tie or a lip tie, some of the symptoms that may tell you that that's happening would be mom with very damaged and sore nipples, a baby who isn't gaining weight well, or a mom with low milk supply, a baby who makes a lot of noise at the breast when they're feeding, clicking, smacking, sounds like they're taking in a lot of air. That causes one of the other symptoms to be a baby who's very gassy and uncomfortable. If you think that your baby is dealing with a lip tie or a tongue tie, it's important that you contact an international board-certified lactation consultant. They are trained in how to properly identify a tongue tie. They can also refer you to a practitioner who understands how the tongue functions during breastfeeding and also understands how important the aftercare is. The reason that the aftercare is so important is that what we don't want to happen is for the skin to reattach, which causes those same symptoms to come right back. So after the tongue tie is done and the lip tie, it's important that these, they're called stretches, exercises, it's important that these are started for the tongue tie the day of the procedure. For the lip tie, we usually recommend that you wait a couple of days to start the stretches. They should be done a few times a day for 2 to 3 weeks, or as otherwise instructed by the practitioner who performed the revision. So I'm going to show you today how to do both the stretches for the tongue as well as for the lip. So we have our little guy here, and we're going to lay him down. It's easiest if you are at the baby's head, so kind of upside down. And then, so, you play a little bit, and then we're going to go in. I get my fingers to the base of his tongue, and I'm going to push up and back and count to 3. 1, 2, 3. And then I let go. For the lip, we have just a couple of stretches that we do. The first is kind of a roll. So you take your index finger, you place it under the lip, and you just kind of roll it up, just like that. And then the other thing you want to do is just take the lip and kind of flip it back up like that. And that's it. All right, buddy, we're all done. We're all done. And that is how to properly do the post-frenotomy aftercare. If you would like more videos on how to breastfeed, you can check out our YouTube channel, DIY Breastfeeding. You can also check out our websites, New Mommy Media, as well as the San Diego Breastfeeding Center. And we thank you for watching DIY Breastfeeding.